let's talk about very common entity in today's world, that is epilepsy. Over 50 million people are affected with epilepsy on this planet. First of all, let us see what is epilepsy. People, they keep on telling seizures, epilepsy. In Hindi, conventional people, they call daura pad gaya. What exactly is this epilepsy? What exactly is seizure? Seizure is nothing but an isolated occurring of a sudden electrical disturbance which occur in the brain. If you see this, our brain is full of electrical activity. If this electrical activity is either interrupted or a short circuit occurs, just like a short circuit in our house, if it occurs, suddenly there can be a fire. Similar thing, when there is a abnormal electric current generated in our brain, this seizure occur. Commonly everybody knows that the seizure is just, patient become unconscious, they will cut their tongue, frothing at the mouth, rolling of the eyeballs. That is a commonest variety what everybody knows about. That like movement of the body is there, that patient looks like that, there is a frothing and there will be incontinence lasting for 1 or 2 minutes. That's a one garden variety which is there. Nowadays, it was there also before. They have classified into various types. It may be like a focal seizure. Only there can be a movement of one hand which is lasting for a minute, half a minute, or it can be sudden loss of consciousness. There may be abnormal sudden behavior of a person, suddenly jerk. The common thing which occurs nowadays is what we call as a juvenile myoclonic epilepsy. Suddenly, early morning, person is brushing the tooth, suddenly he falls down with a jerk. Or the instruments which are there in his hands, like utensils, suddenly they fall off. Suddenly a jerk, which they don't know what is happening. It can be another type of epilepsy, what we call as myoclonic epilepsy. If seizure, if it occurs 2 times with a gap of more than 24 hours, it is called as epilepsy. It is that simple as that. Depending upon the age, if a small baby is there, like common thing between the age of 2 and 6 years or 7 years, a small baby, almost 2 to 5% people can get, whenever there is a high fever, they can get a seizure, what we call as febrile seizure, where there is no cause for that seizure, but with the fever, some electrical impulses get triggered in the brain and the baby can get a seizure. Usually decreasing the fever, controlling the fever, and in future also, if we control the fever, it will not recur, and after the age of 5 or 6 years, they will disappear on their own. But if the child gets seizure in between 2 fevers, then we need to treat. But coming to adult population, epilepsy is very prevalent in after the age of 18 years. It can occur at elderly also. It doesn't have any gender or age bar. It can happen at any age. The commonest thing is when we do an investigations, almost 30 to 40% we don't find a cause for it. But 50 to 60% we can find a cause, like at the birth time there may be decreased supply of oxygen to that boy, and at the certain age he can manifest as seizure. There may be infection of the brain which might have occurred in the past. There may be head injury which has occurred in the past, and then there will be a scar, what we call a scar epilepsy. There can be cause tuberculosis of the brain, cyst of the brain, neurocystic psychosis. We'll talk about neurocystic psychosis in a little later in detail. And stroke of a patient, or sometimes an embolism from the heart, a clot from the brain can cause a seizure in the brain. And in the elderly, we should know that there are on multiple medications, low sodium, low calcium, and increased urea creatinine, increased sugar can trigger a seizure episode in such cases. So how do we investigate this seizure and whom to approach? The best person to treat is a neurologist, and when he takes a history properly, and in few cases they may find a family history of epilepsy also, because epilepsy can be familial as well. So once you come, baseline investigations are done, EEG is the one where we do this and we get electrical disturbance. Sometimes it can be normal also. To find out if there is a cause for this epilepsy, we do MRI of the brain to find out a cause for it. In our particularly in this region of the subcontinent, there is an entity called as a neuropsysticercosis. Everybody says in their language that there is a worm in the brain. जैसे brain में कीड़ा हो गया है. But actually one should know there are a lot of myths involved. There is no कीड़ा there in the brain. Only egg of the brain, egg of the cyst is there. And that egg of the worm, in fact, to correct myself, egg of the worm is there which doesn't move. This skull is so airtight compartment. Few people, particularly in area like Rajasthan, people go to treat as a lay person. He keeps a bottle and takes out a worm from the nose. They should, everybody should know, even the air cannot come out from up and down from the skull through the nose. Leave apart that worm which is coming out. And second thing, I have already told, it is a cyst in the brain. And actually in 3 to 6 months time, in many cases like 30 to 50%, it disappears on its own only. But epilepsy treatment has to be continued. And nowadays the advancement is so much, almost 15 to 20 different types of medicines are available to treat. Almost 70% of the people, when they take this medicine 2 to 3 years, depending upon the circumstances, if they are seizure free, then they get an EEG done and taper off the medicines. Another myth is they listen wrongly, that if you take 3 years, if you are cured, you stop the medicine. No, at the end of 3 years, with proper guidance under a neurologist, they taper off slowly, which may take 6 to 7 months or 9 months to decrease the medicine and check. If there is a recurrence during this period, which is possible in 30% of the people, they have to restart the medicine. There is no other options, no other way out. And sticking to the medicine is proper aspect of treatment. Second is sleep is very important in such cases, particularly in juvenile myoclonic epilepsy, a type of epilepsy which is triggered by lack of sleep. And most of the epilepsy can trigger by, so sleep is very important factor. Third is to prevent from that neuropsysticercosis worm. It is not the vegetable which causes it. Vegetables have to be washed properly because it comes with a contamination from the farm where they use lot of manure. The cyst can land up there. So if it has to be washed thoroughly and then eaten. Hand wash is a very, very important factor for treating epilepsy. So whenever you found out this kind of epilepsy, we have seen certain patient of epilepsy, they may not have epilepsy, they may have epilepsy mimic, like it may be a psychological trigger also in such cases, which anyway can be differentiated by history taking and proper investigations. So that's not about epilepsy, but other myths has to be solved also. People, what they do, they put footwear, they put onion, they put metal objects, in the mouth, on the nose. Please don't do such things. It causes more harm. When a person is having epilepsy, the first thing is make the his dress loosen, make him lie on one side, left or right, so that he doesn't aspirate his own saliva. That is the second part. Third is don't increase the trouble by putting water. Anyway, he is unconscious, so he may aspirate. Don't put any metal objects or footwear on his mouth, and then of course approach the doctor. Usually, fortunately, these type of seizure, when they occur, they abort on their own within a minute or two. That is very, very important, today's message. Second is why we have to stick to the medicine. It has been found out there is a condition called as sudden unexpected death in epilepsy. Usually if they don't take treatment, the chances of their death during sleep is very high. So treatment of taking regularly can even prevent this SUDEP complications. Thank you so much.